We have everyone here, so I think we may be okay to get started. Nicole, are you ready to get started as well? Oh, perfect. I see.
Here.
Great,
Thank
thank
you.
you. Welcome to the April 29th, 2026 Legislation and Regulation Committee meeting. My name is Jessie Crowley, chairperson of the committee. Before we convene, I'd like to remind everyone present that the board is a consumer protection agency charged with administering and enforcing pharmacy law. Where the protection of public is inconsistent with other interests sought to be promoted, the protection of the public shall be paramount. As I facilitate this meeting, I will announce when we are accepting public comment. I've advised the meeting moderator to allot 3 minutes to each individual providing comments. We will begin with public comments for individuals attending in person, followed by public comments by individuals participating via WebEx. This approach is necessary to facilitate the meeting. Before we get started, I would like to ask staff moderating the meeting to provide general instructions on the process for providing public comment via WebEx.
Hi, this is the moderator. If you would like to make a comment on any agenda item during the meeting, you may look for the raise hand icon at the bottom of your WebEx screen. And if you are joining us on a mobile device, the hand icon may be behind 3 dots, other options. And if you are a call-in user, you can press *3 to raise your hand. Requests to comment will be called upon in order they are received. Once your name is called out, you'll see a prompt on your screen to unmute yourself. For members of the public joining while dial-in, you can press *6 to unmute yourself. And there's going to be only one public comment per agenda item allowed per attendee. Thank you.
Thank you. I would now like to take a roll call to establish a quorum. Trevor Chandler, I believe he's not joining us today. Jeanette Dong.
Present.
Thank you. KK Jha, I believe he's not joining. Maria Serpa.
Licensee member present.
Thank you. Nicole Tebow.
Licensee member present, and no other persons 18 years or older are present with me in the room at this time.
Thank you. And I'm present. A quorum has been established. Members, we have a full agenda for our meeting today. I ask everyone participating today to be respectful of the work before the committee. We encourage participation by members of the public throughout our meetings at appropriate times. The committee respectfully requests that when comments are provided, they're done so in a professional manner consistent with how the committee conducts its business. Finally, before we move to the next agenda item, I would like to remind committee members participating via WebEx to please remain visible on camera throughout the open portion of today's meeting. Members, if you need to temporarily turn off your camera due to challenges with internet connectivity, please remember to announce the reason for your non-appearance when you turn off your camera. Agenda item 2, public comment on items not on the agenda or items for future meetings. I would like to remind everyone that the committee cannot take action on these items except to decide whether to place an item on a future agenda. Members, following a review of public comments for this agenda item, I will ask members to comment on what, if any, items should be placed on a future agenda. As a reminder, this agenda item is not intended to be a discussion, but rather an opportunity for members of the committee and members of the public to request consideration of an item for future placement on an agenda, at which time discussion may occur. Are there any members of the public in Sacramento that would wish to provide public comment for items not on the agenda? Seeing none, I will now ask the moderator to open the line for individuals to provide opportunity to provide public comment. You are not required to identify yourself, but may do so. Moderator, we're ready for public comment for items not on the agenda from individuals participating via WebEx.
Hi, this is the moderator. If you want to make a comment, please click on the raise hand icon at the bottom of your WebEx screen. We are also displaying instructions and we'll give you a moment. I see no comments. I've returned the floor back to you, Chair.
Great, thank you. Members, bringing it back to us, is there any member that wants to add an item for a future agenda? Perfect, seeing none. Agenda item 3, discussion and possible action to approve the June 11th, 2025 Legislation and Regulation Committee meeting minutes. Members, as we begin it for our consideration, I will ask if members have questions or comments on the draft minutes from the June 11th, 2025 meeting. I would also entertain a motion if you believe such action is appropriate.
I move for acceptance to approve the June 11th, 2025 Legislative and Regulation Committee meeting minutes as presented in the meeting materials.
Thank you, Maria.
This
Do
is
we have-
Nicole. I'll second.
Great. Thank you, Nicole. With a motion and a second on the floor, I will now open the discussion for public comment on the June 11th, 2025 draft minutes. Are there any members of the public in Sacramento that would like to provide comments? Seeing none, moderator, we're ready for public comment via WebEx.
Hi, this is the moderator. If you would like to make a comment, please click on the raise hand icon at the bottom of your WebEx screen. And if you are a call-in public member, you may press *3 to raise your hand. We are displaying instructions and we'll give you a moment. We see no comments. I return the floor back to you.
Great, thank you. Okay, so we're ready for the roll call. Jeanette, how do you vote?
I abstain since I was not present.
Okay, thank you. Maria?
Yes.
Thank you. Nicole?
Yes.
Thank you. And I vote yes, the motion passes. Agenda item 4, discussion and possible action to recommend to the board positions on pending legislation impacting the practice of pharmacy, the board's jurisdiction, or board operations. Members, there are several measures on today's agenda for our discussion. February 20th, 2026 was the last day to introduce bills, and April 24th was the last day for policy committees to hear and report to fiscal committees bills keyed as fiscal. May 15th is the last day for fiscal committees to hear and report to the floor bills introduced in their house. I'm highlighting these deadlines as I believe it's important to note that the legislature is very early in the legislative cycle. Given our next meeting is scheduled for June 11th, it may be appropriate to watch some measures at this time rather than establishing a position, so we can monitor them at least the first policy and appropriation committee hearings. Sorry, my Boston accent came out for a second. The meeting agenda and materials identify pending measures impacting the practice of pharmacy, the board's jurisdiction, or board operations that were identified during the development of the agenda for this meeting. Members, do you have any questions or comments before we proceed? Perfect, hearing none. Assembly Bill 910, Pharmacy Benefit Management. The first measure for our consideration is Assembly Bill 910. Members, this measure requires the Department of Healthcare Access and Information, HCAI, to include prescription drug pricing and payment data in its annual healthcare report and to notify the Department of Managed Healthcare, DMHC, if a pharmacy benefits manager, PBM, fails to comply with specified requirements. The measure also requires DMHC to post its links on its website to analyses and reporting published by HCAI. The measure passed out of the Assembly with 71 votes in support, 2 in opposition, and 7 in abstention. I agree with the staff recommendation to support the measure and note that this measure builds upon SB 41 by strengthening data transparency via data collection and analysis of pricing and payments and regulatory enforcement by creating a notification pathway for when PBMs don't comply, and it ensures public transparency via DMHC's website. Members, I welcome your thoughts on this measure and would also entertain a motion recommending a position if you believe such action is appropriate. Go ahead. Nico.
Hi, this is Maria. I move to recommend or to accept the recommended position of support.
Great, thank you, Maria.
This is Nicole. I'll second.
Great, thank you. I think Nicole. Perfect. Perfect. With a motion and the second on the floor, are there any members of the public in Sacramento that would like to provide public comment on this agenda item? Hearing none, moderator, we're ready for public comment via WebEx.
Hey, this is a moderator. If you would like to make a public comment, please click on the raise hand icon at the bottom of your WebEx screen. And if you're a dial-in public member, you can press *3 to raise your hand. We are also displaying instructions and we'll give you a moment. See raised hands. I turn the floor back to you, Chair.
Great, thank you. We're ready for the roll call vote. Jeanette, how do you vote?
Yes.
Thank you. Maria, how do you vote?
Yes.
Okay. Nicole, how do you vote?
Yes.
Thank you. And I vote yes, the motion passes. Assembly Bill 957, Cigarette and Tobacco Products Retail Sale of Pharmacies. Members, AB 957 would prohibit a pharmacy from selling cigarettes or tobacco products. The policy goals of the measure appear consistent with the board's policy statement included in the meeting materials. This is a 2-year bill that was granted reconsideration in July 2025 by the Senate Business Professions and Economic Development Committee. The board previously established a support position on this bill, and I believe that position remains appropriate. I note that the measure has not moved since reconsideration that was granted last year. Members, I welcome your thoughts on the measure.
I move to support.
Great, thanks. Okay, great. So we'll keep the support position. Do we have a second?
Second.
Thank you, Maria. With a motion to support and a second, we're ready for public comment in Sacramento. Seeing none, moderator, we're ready for public comment via WebEx.
Hi, we do have a public comment. The number ending with *45, you're going to be seeing an unmute request. You can press *6 to unmute and make your comment. You'll have 3 minutes with a 10-second warning. Please click on *6 to unmute and make your comment. Thank you.
Hello, this is Pharmacy Technician 106559, Ms. Chasney Johnson. The key aspects and purpose of Assembly Bill 957 is to prevent the sale of tobacco products at pharmacy, aligning with public health goals to reduce tobacco usage and avoid conflicting messages at health-oriented businesses. The bill asserts that tobacco products do not belong in healthcare settings. We as healthcare providers should have signage around organization premises because looking out your office window or enjoying your lunch, you do see employees, personnel in their work apparel outside having a cigarette. Supporting assembly bills that is supported by the organization like the American Heart Association is important because they are evidence-based and designed to improve public equity and safety. If Assembly Bill 957 is set forward, visual informational signs would demonstrate support and align businesses with progressive health values, strengthening community reputation and customer loyalty. Thank you for having this provided space to discuss this agenda item.
Great, thank you so much for your comments.
Thank you. I see no other raised hands. I turn the floor back to you, Chair.
Great, thank you, moderator. Okay, so we're ready for the roll call vote. Jeanette, how do you vote?
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes, sorry. I couldn't find my mute button.
Thank you, Nicole. And I vote yes, the motion passes. Assembly Bill 1460, Prescription Drug Pricing. Members, AB 1460 would prohibit a prescription drug manufacturer from blocking or interfering with qualifying nonprofit community health clinics' ability to buy drugs at a reduced federal 340B price under specified conditions. This is a 2-year bill that has been held at the Senate Health Committee. The board previously established a support position on this bill, and I believe that position remains appropriate. Members, I welcome your thoughts on the measure. Okay, since we still have a support position, I don't hear anything from members. We can open it up to public comment. Do we have to? Yeah, we'll open it up for public comment in the Sacramento location. Seeing none, moderator, we're ready for public comment via WebEx.
Hi, this is the moderator. If you would like to make a comment, please click on the raise hand icon at the bottom of your WebEx screen. And if you are a dial-in call-in user, you can press *3 to raise your hand. I do see one request, and Andre, I'm gonna send you an unmute request. Please click on that to make your comment.
Good morning. Can you hear me okay?
Yes, we can. Please go ahead.
Yeah, thank you. When I originally saw this bill, me and my colleagues were actually very excited about it because it afforded some protections for the 340B discount plan, which is a plan that is crucial for the patients in California. We did notice that there were some amendments, specifically subsection F, that gives manufacturers the ability to require additional information that is not required under federal law from the 340B participants in California. And so that unfortunately changed the outlook on this bill so much. It would raise significant administrative costs for pharmacies to provide that information. And I think there must be awareness created that manufacturers have tried to dismantle the 340B federal discount plan systematically over the past three decades since it got into law. They hate it because it forces them to give discounts, and ultimately these discounts are being used to benefit patients and provide new services to patients. So because of this change, I think we have to give strong consideration of maybe changing a position to this bill. If I would respectfully ask if you could maybe not support the bill, because it's bad for patients and it's also bad for pharmacies participating in the 340B plan. It really takes away a lot of the advantages of the bill. It adds cost and administrative costs and effort, and most places would need to give consideration for adding staffing to just manage this aspect of subsection F. So thank you. I hope you'll consider maybe changing the position on this one. This is not a good bill for patients.
Thank you so much for your comments.
I see no other raised hands or comments. I return the floor back to you, Chair.
Thank you very much. Members, do you have any additional comments? I don't want to put pressure on Nicole, but I would be curious to see what your thoughts are as the expert here.
Sure. I actually have a question for Corinne first. Corinne, if my organization is a co-sponsor on a bill, do I have to abstain, and should I not make any comments?
Yeah, I think that would probably be the right approach, Nicole.
So I can't say anything, Jesse. Sorry.
It's okay. Thank you, Nicole.
I have a comment, Madam Chair. The 340B program is critical to the public health safety net for patients. And at a time when the indigent healthcare system is being dismantled by the federal government, 340B is critical.
Great. Thank you so much. Any other thoughts? No? Okay. That sounds like we still have a support position, so we'll move on to the next agenda item. Assembly Bill 1558, Uniform Emergency Volunteer Health Practitioners Act. Members, AB 1558 would create the Uniform Emergency Volunteer Health Practitioners Act, establishing a statewide system to register out-of-state volunteer health practitioners, such as physicians, pharmacists, and veterinarians, to support services during a declared emergency. The Emergency Medical Services Authority would administer the program and could limit the duration, location, or type of volunteer practice during an emergency. The measure would allow the board to restrict or modify the services a volunteer practitioner may provide. It would also authorize the board to impose administrative sanctions on in-state licensees for misconduct committed during an out-of-state emergency response, and on out-of-state practitioners for misconduct in California during an in-state emergency, provided certain conditions are met. I agree with the staff recommendation to establish a support if amended position. Board staff believe technical amendments are necessary to establish a feedback loop between the Emergency Medical Services Authority and the Department of Consumer Affairs / the Board of Pharmacy to ensure that the board is notified of licensees providing emergency medical services both within and outside of California. This measure is currently awaiting consideration by the Assembly Appropriations Committee. Members, I welcome your thoughts on the measure and would also entertain a motion to recommend establishing a position if you believe such action is appropriate.
Hi, Jesse. I'll propose that we take a support if amended position.
Great. Thank you, Nicole. Do we have a second?
I'll second.
Great. Thank you. With a motion on the floor, we are now ready for public comment in Sacramento. Seeing none, moderator, we're ready for public comment via WebEx.
Hi, this is a moderator. If you would like to make a comment, please click on the raise hand icon at the bottom of your WebEx screen. And if you are a public member joining us by call-in, you may press *3 to raise your hand. You'll have 3 minutes with a 10-second warning to make your comment. And we are displaying instructions to give you a moment. I see no comments. I return the floor back to you, Chair.
Thank you. We're ready for a roll call vote. Jeanette, how do you vote?
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes. The motion passes. Assembly Bill 1587, Prescription Drug Refills, Prescriber Notifications. Members, as amended, AB 1587 amends the conditions for pharmacist authority to provide emergency refills to specify that notification to a prescriber is only required if a prescriber is identified. Following the release of the committee meeting materials, the measure advanced out of Assembly and was subsequently sent to the Senate. I agree with the recommendation to establish a watch position. Members, I welcome your thoughts on this measure and would also entertain a motion to recommend a position if you believe such action is appropriate.
Hey, Jesse, it's Nicole. I'm a little confused about this bill. When I originally saw it before some amendments were made, it seemed like they didn't know that we could already do an emergency refill. And then once someone pointed that out to them, they just changed it to make it about the provider. Does anyone have any context about what the point of this bill is or was? I do agree with a watch position, but I feel like there's a missing context here, or like someone just didn't know we could do it and made the bill. It also originally mentioned life-threatening conditions only, which I think has now been amended, but I'm just confused as to why this exists.
Thank you, Nicole. I want to pass it over to Anne to answer that one.
So Nicole, what I would say is, yes, I believe as originally, as originally proposed, it would have created significant conflicts with existing authority. And so I believe that the amendments were to just it as it stands is to, I believe, provide clarity for a pharmacist that would like to exercise this authority to make it explicitly clear that they don't have to have the prescriber. If that makes sense, hopefully.
That does. Thank you all so much. Do we need a motion for a watch position or do we not?
No,
I don't.
motion needed.
Okay.
Perfect. Any additional comments from members? Nope.
It says it's recommended. Does that mean that we don't need a motion and vote? We don't have a position right now.
You don't need a motion for a watch.
Okay.
Yeah.
So if someone were to officially ask us what our position is, we could say watch even though we haven't voted on that? Or we would just say we have no position?
We don't have a position. It's either support or
Yeah, so I think that's the
opposed.
difference. And I'm not sure if that makes a difference to the chair, is having no position versus having an official watch position. Those are two different things. So,
But you don't need a motion for a watch. For sure.
I understand she's the attorney, but
Yeah, I'm gonna
defer to the attorney.
defer to the attorney here. Yeah, as the non-lawyer. Great. I think that we're good. We're ready for public comment in Sacramento. Seeing none, moderator, we're ready for public comment via WebEx.
Hi, this is a moderator. If you would like to make a comment, please click on the raise hand icon on the bottom of your WebEx screen. And if you are a call-in public member, you may press *3 to raise your hand. We are displaying instructions and we'll give you a moment. I see no comments. Return the floor back to you.
Thank you. Members, Assembly Bill 1773 requires the Department of Managed Healthcare to maintain a public website displaying specified information for each licensed pharmacy benefits manager, including, among other things, the legal name, license number, and license expiration date. Following the release of the committee's meeting materials, the measure was ordered to the Assembly consent calendar. I agree with the recommendation to establish a support position. Members, I welcome your thoughts on the measure and would also entertain a motion if you believe such action is appropriate. Okay, well, I guess I'll make the motion to establish a support position.
I'll second.
Thank you. With a motion and a second, we're ready for public comment in Sacramento. Seeing none, moderator, we're ready for public comment via WebEx.
Hi, this is a moderator. If you would like to make a comment, please click on the raise hand icon at the bottom of your WebEx screen. And if you are a call-in public member, you may press *3 to make your comment. We are displaying instructions and we'll give you a moment. I see no raised hands. I return the floor back to you.
Thank you. We're ready for the roll call vote. Jeanette, how do you vote?
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes, the motion passes. Assembly Bill 1775, Veterans. Members, Assembly Bill 1775 extends the current expedited licensing process for veterans to also cover service members who were discharged solely because of the federal action to restrict military services by transgender individuals, not just those who were honorably discharged. This measure is awaiting consideration by the Assembly Appropriations Committee. I agree with the recommendation to establish a support position, as the board has historically supported measures that impact licensure access for military members, veterans, and military spouses. Members, I welcome your thoughts on this measure and would also entertain a motion if you believe such action is appropriate.
Hi, Jesse. I move to take a support position.
Thank you. I'll second your motion, Nicole. And looks like none of the other members have any comments, so we're ready for public comment in Sacramento. Seeing none, moderator, we're ready for public comment via WebEx.
Hi, this is a moderator. If you would like to make a comment, please click on the raise hand icon at the bottom of your WebEx screen. And if you are a call-in public member, you may press *3 to raise your hand. We are displaying instructions and we'll give you a moment. I see no comments. I return the floor back to you, Chair.
Thank you. We're ready for a roll call vote. Jeanette, how do you vote?
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes, the motion passes. Assembly Bill 1778, Controlled Substances, Testosterone. Members, Assembly Bill 1778 removes testosterone from California's Schedule III Controlled Substances list automatically if the federal government removes it from its scheduled controlled substance list without requiring separate state legislation. Following release of the committee meeting materials, this measure passed out of the Assembly Public Safety Committee and was referred to Assembly Appropriations. While I agree with the recommendation to establish a watch position, I note that testosterone may be misused and abused, and as a result of AB 82, is no longer reported to cures. Removing it from California's schedule could lead to overprescribing and increased risk of misuse. Members, I welcome your thoughts and would also entertain a motion if you believe establishing a position is appropriate.
Hi, Jesse. It's Nicole. I would actually like us to consider having a support position, or if we felt an amendment was needed to take that, a support if amended, because of people who get gender affirming healthcare that use masculinizing hormones, because testosterone is a controlled substance and most of the other drugs that are used for it are not, we're seeing discrepancies in access for trans people and non-binary people who want a masculinizing protocol versus feminizing. So I think this would be an opportunity to decrease some of those barriers. I also want to highlight that I'm getting reports. I don't have a lot of specifics, and I will share with the board when I have more, but I'm hearing reports of people struggling to access their gender affirming care drugs for trans people specifically in California because of the recent federal action. So I think that's something we should be aware of, and this gives us an opportunity to help. I know that gets really tricky, and I think it would be very difficult to parse out when it's being used for cisgender men versus when it's being used, for masculinizing purposes for trans people. I don't know if that's a can of worms we want to touch, but the risk is different in those groups of abuse, and I think we're causing significant harm to one group because of the actions of a different group, potentially.
Thank you for that perspective, Nicole. I really appreciate that. Did you want to formally make a motion to support if amended? Or do you have any recommendations of what the amendment would be?
Yeah, I don't know what the amendment would be, and if there's anything that the board can think of that would make them feel more comfortable. I would like us to somehow get to a support position, but I'd be open to hearing other people's thoughts before formalizing that.
No, I agree with you. I think you brought up some really good points, particularly, like you said, it is different for maybe a cis man who's using it, and maybe that sort of abuse that can be seen is much different. And I do think the risk of access to specifically trans and non-binary folk is something that we can consider on the forefront. I'd be open to establishing a support position. Maria, did you have any additional thoughts?
Yeah, just a couple of thoughts. One is, I guess, logistical, is we could have a position now, or we could wait until June, when our next meeting, to make position. There's some pros and cons to either of those. For me, I am always adverse to having a medication, a drug that's different on the federal schedule versus the state schedule. It causes a lot of confusion. And so the concept here is a good one to keep the schedules the same. Even if we don't discuss the reason why the drugs are being used, keeping the drugs the same is strongly supported.
I agree with that too, Maria. Any other additional thoughts?
Okay, I'll formally recommend a support position.
Thank you, Nicole. I'll second that motion. And it looks like we're ready for public comment in Sacramento. Seeing none, moderator, we're ready for public comment via WebEx.
Hi, this is a moderator. If you would like to make a comment, please click on the raise hand icon at the bottom of your WebEx screen. And if you are a public member joining us via call-in member, you can press *3 to raise your hand. We do have a comment. Fadi, you're going to be seeing an unmute request. Please click on that to make your comment.
Hi, this is Fadi Keith from UC Davis South. Thank you for the opportunity to make a quick comment. But just a quick comment on the potential for abuse. Potential for abuse of testosterone if it doesn't become, if we basically remove it from a scheduled substance, there shouldn't be a difference between a cis or a non-cis man. The potential of abuse exists regardless. So I want to, as a committee, to take into consideration this point when it comes to potential for abuse. Just a quick comment.
Thank you so much for your comment.
I see no other comments. I turn the floor back to you, Chair.
Thank you. We're ready for a roll call vote. Jeanette, how do you vote?
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes. The motion passes. Assembly Bill 1794, Pharmacy Enteral Products. Members, AB 1794 authorizes a pharmacist, manufacturer, or wholesaler to participate in an arrangement or agreement to deliver enteral nutrition supplements or replacements directly to a patient's resident pursuant to a valid order from a prescriber acting within their scope of practice. This measure is being considered by the Assembly Appropriations Committee today. You will note that the board staff are not offering a recommendation on this measure. Members, I welcome your thoughts on this.
Hi, Chair Crowley. Similar to an earlier one that I asked about, I don't get what problem this is trying to solve. I don't know a lot about enteral nutrition. So can anyone share, like, what is this trying to do? Is it going to like skip being checked by a pharmacist? Or is it like more like dialysis drugs now? Is it for patient access? Like, what are we trying to achieve here?
I'm going to turn it over to Anne.
So again, I can't totally say. What we've been advised, at least at the staff level, is that there's been some changes in some payer practices, and the drop ship model was no longer being allowed. So you'll notice that the bill has been amended from originally it was pretty broadly written and was going to like all of the supplemental items that go along with the supplements themselves. So it has now been narrowed to just the supplements, not necessarily the full product, the tubing, all of those things. So it is now the way that it's drafted, as I understand it, not my area of expertise at all, and nor am I a pharmacist or an attorney. So now that I've gotten all of my disclosures and disclaimers out of the way, what I would say is I think that the way in its current, the way that it is currently drafted, I believe would allow for the shipment of the supplements specifically, not necessarily all of the other things, directly from the manufacturer or the wholesaler. So it does, in that manner, Nicole, is similar to dialysis patients where product can be, sent directly to the patient's home. So I believe that that's what the intent of this is.
Got it. Thank you so much for explaining. I was so confused by that one. I do feel fine with staying with no position. I'm not recommending anything one way or another. I just wanted to understand what the goal was here. Thank you.
Hi, this is Maria. I also agree that we need some more information. I'm concerned about the words supplement versus replacement. They mean totally different things, and that is a very big issue for patients who need supplements and oftentimes don't have insurance coverage for supplements. So I know that this much about this issue, but I know it is a deep issue. And I have concerns also that opposition is by the California Pharmacists Association. So hopefully during public comment, they will speak to why they oppose. But in the meantime, I agree with having no position.
Thank you. Perfect. Looks like we're ready for public comment in Sacramento. And seeing none, moderator, we're ready for public comment via WebEx.
Hi, this is a moderator. If you would like to make a comment, please click on the raise hand icon, typically at the bottom of your WebEx screen. And if you are a call-in public member, you may press *3 to raise your hand. You'll have 3 minutes with a 10-second warning to make your comment. We are displaying instructions and we'll give you a moment. I see no comments or raised hands. I turn the floor back to you, Chair.
Thank you. Assembly Bill 1811, Health Professional Shortage Areas. Members, as amended, AB 1811 defines health professional shortage area until January 1st, 2035 to include areas designated by California's Department of Healthcare Access and Information, areas federally designated by HHS, and those federally designated on January 1st, 2025, even if no longer federally recognized. As such, this measure ensures areas proposed for withdrawal post-2025 remain eligible for state prioritization and benefits. This measure is currently awaiting consideration by the Assembly Appropriations Committee. I agree with the recommendation to establish a support position. I note that this measure maintains current shortage areas and believe amendments to clarify its application to pharmacies as defined health professional shortage areas. Members, I welcome your thoughts on the measure and would also entertain a motion if you believe such action is appropriate.
This is Nicole. I'll move to support.
Thank you, Nicole.
For a second, I wanted to ask a question because it may change is, why are staff suggesting possible amendments, but still also recommending a support? Is there a reason why those amendments are not important enough for support if amended?
So I think that at the staff level, we're not quite, whether or not it applies to pharmacy is an outstanding question. And so we would want to confirm that it does apply to pharmacy, and if not, request technical amendment to make it explicit that it is required. I'm sorry, I just jumped in. I'm so sorry.
Oh, no, I was going to tell you to
Look at you.
gently suggest that you respond to that. You have a better response than me.
So is that the most expeditious way is to support, and then if amendments are needed to change it to support if amended? I'm just, what's best for, I mean, obviously, what's best for staff is what they recommended in the report.
So I think at the staff level, we believe this is good policy no matter what. And then gets better if we get clarification.
Okay.
I don't know if I made sense, but.
Yeah, thank you. Then I go ahead and second Nicole's motion.
Great. Thank you, Maria.
Can I ask a question?
Sure.
And historically, the shortage areas, do they include pharmacy or do they include pharmacists in the shortage areas? I know they include clinicians, but do they include pharmacists traditionally?
So I
Depends.
think that that's what some of the challenges. I'm not quite sure that we know the full answer to that, being super candid.
Okay, thank you.
Can
Thank
I jump in too and just say for Jeanette that even if it doesn't include pharmacies, it can impact pharmacies because it can, and it can impact things like the 340B program because it can be relevant to clinics and like certain other locations that would then send those prescriptions to pharmacies. So I think it has an indirect impact on pharmacies, if not a direct.
Thank you. Okay, we're ready for public comment in Sacramento. And seeing none, we're ready for public comment via WebEx.
Hey, this is a moderator. If you would like to make a comment, please click on the raise hand icon at the bottom of your WebEx screen. And if you're a call-in public member, you may press *3 to raise your hand. We are displaying instructions and we'll give you a moment. I see no raised hands or comments. I return the floor back to you, Chair.
Thank you. We're ready for a roll call vote. Jeanette, how do you vote?
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes, the motion passes. Assembly Bill 1854, Legally Protected Healthcare Activities. Members, as amended, AB 1854 stops California agencies in law enforcement from helping other states with arrests, information requests, or investigations related to certain protected healthcare services, such as reproductive care or gender-affirming care. It also blocks subpoenas, warrants, and other legal requests from other states, except in very limited situations. Members, this measure is awaiting consideration by the Assembly Appropriations Committee. I agree with the recommendation to establish a support position. Members, I welcome your thoughts on this measure and would also entertain a motion if you believe such action is appropriate.
I move to take a support position.
Thank you, Nicole.
I second that.
Thank you, Jeanette. And we're ready for public comment in Sacramento. Seeing none, moderator, we're ready for public comment via WebEx.
Hi, this is a moderator. If you would like to make a comment, please click on the raise hand icon at the bottom of your WebEx screen. And if you are a call-in public member, press *3 to raise your hand. We are displaying instructions and we'll give you a moment. See no comments, I turn the floor back to you.
Thank you. We're ready for the roll call vote. Jeanette, how do you vote?
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes, the motion passes. Assembly Bill 1930, legally protected healthcare activity, inquiries, investigations, subpoenas, or summons. Members, as amended, AB 1930 would stop any person or business in California from giving information to another state about legally protected healthcare activities. Sounds very similar to the last one. Unless specified conditions are met, including that the request must include an affidavit stating under penalty of perjury that the investigation involves an act that is actually illegal under California law, and it must identify the specific California law that was violated. Following release of the committee meeting materials, this measure passed out of Assembly Public Safety Committee and was referred to Assembly Appropriations Committee. I agree with the recommendation to establish a support position. Members, I welcome your thoughts on the measure and would also entertain a motion if you believe such action is appropriate.
This is Nicole. I will also move to support this bill.
Thank you.
I'll second.
Thank you, Maria. We're ready for public comment in Sacramento. And seeing none, moderator, we're ready for public comment via WebEx.
Hi, this is the moderator. If you would like to make a comment, please click on the raise hand icon at the bottom of your WebEx screen, or you can press *3 if you're a call-in public member. We are displaying instructions and we'll give you a moment. See no comments. I return the floor back to you, Chair.
Thank you, moderator. We're ready for a roll call vote. Jeanette, how do you vote?
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes. Assembly Bill 1979, Healthcare Services, Artificial Intelligence. Members, AB 1979 was amended following the release of committee meeting materials. The policy goals of the measure remain the same, ensuring that a licensed healthcare professional working in a health facility, clinic, physician's office, or office of a group practice exercise independent professional judgment when reviewing and approving clinical decisions that are based on the output from a clinical decision support system. Additionally, it authorizes the appropriate licensing board to seek an injunction or a restraining order when violations amount to the unlicensed practice of health profession. The measure clarifies that these restrictions do not prohibit the use of artificial intelligence for non-clinical tasks that do not require professional judgment, such as documentation or automated patient notifications. Following release of the committee meeting materials, this measure passed out of the Assembly Privacy and Consumer Protection Committee and was referred to Assembly Appropriations. As amended, the measure still does not explicitly apply to pharmacies and may not cover all settings where pharmacists and advanced pharmacist practitioners may work. I believe that the prohibitions should extend to all practice sites where healthcare providers, including pharmacists, are providing patient care services. I also note that the board raised concerns with the use of AI as part of its 2025 Sunset Report and noted that while the board does not believe a total prohibition of the use of AI in pharmacy practice is either necessary or in the best interest of patients, and while the board believes that AI is a tool to assist pharmacists in making a clinical judgment, the board stands firm that AI cannot and should not supplant such clinical judgment. The policy goals of this measure align with the board's position. I agree with the recommendation to establish a support if amended position and recommend offering an amendment to ensure that the requirements extend to all pharmacist and advanced pharmacist practitioner sites. Members, I welcome your thoughts on this measure.
Jesse, this is Maria. I wanted to speak a minute on this because there is national conversation in pharmacy circles in this area, and I agree with the proposed language on here and to support if amended. I'll go ahead and make that motion as I talk about what's happening in some other states. In one state particularly, but I know that there are others, there are moves to bypass pharmacists and even bypass physicians to do some sort of AI-generated approval for refills. Now, that seems at first like not such a big deal, but it's the step of bypassing a healthcare practitioner in determining whether patients have access or not to treatments and medications. In the state that I won't name, they actually have a pilot project that allows bypassing of current healthcare practitioner regulations. So the pilot program allows them not to follow all current regulations in the medical board, nursing board, pharmacy board, all healthcare boards, to allow review of this AI project and not have the regulatory oversight for patient protection.
Well, thank you, Maria. I appreciate that perspective. Any other thoughts from members? Go ahead, Nicole.
I was going to say, I will second Maria. I'll second the motion, but I did have a question, especially given what Maria just said. Do we have any idea why the Medical Association is opposing this bill? I'm very confused by that position.
That is a good question. I don't have the answer. I'm not sure if Anne does. Sorry to keep tossing it over to you, Anne.
So we've not had any, direct conversations. My read of some of the public materials, I think and I think it was maybe on a prior version of the bill. So I apologize, Nicole, if I'm totally not remembering. I think it was that it was written pretty broadly, and there was concerns about that from
Okay.
their perspective. Yeah.
Got it. So we don't know is the answer, but technically it may not be that they're opposed to the concept. It's more the specifics. Okay, thank you.
Great, thank you. Members, if there are no other thoughts, we're going to open up for public comment in Sacramento. And seeing none, moderator, we're ready for public comment via WebEx.
Hi, this is the moderator. If you would like to make a comment, please click on the raise hand icon at the bottom of your WebEx screen. And if you are a call-in public member, you may press *3 to raise your hand. We are displaying instructions and we'll give you a moment. I see no raised hands. I return the floor back to you, Chair.
Thank you. We're ready for a roll call vote. Jeanette, how do you vote?
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes. The motion passes. Assembly Bill 1990, Pharmacy Law, Compounded Medications, Consumer Protection. Members, following release of the meeting materials, this measure was amended. As amended, the measure continues to declare legislative concerns about unsafe or illicit active pharmaceutical ingredients entering the compounding supply chain, particularly amid high demand for weight loss drugs. It prohibits selling or distributing compounded drugs containing certain GLP-1 or related substances used for obesity or weight management unless the compounder takes specific actions, including ensuring that the bulk drug substance is a pharmaceutical grade product and meets specified requirements. Manufacturers and wholesalers must also provide written verification to purchasers that bulk drug substances sold for this purpose meet specified requirements. The bill makes violation of its provisions subject to license revocation and fines of $1,000 per dose of illegally compounded drug sold, transferred, or distributed. The measure further requires specified record keeping, authorizes board inspections of compounders and suppliers, and prohibits misleading advertising of compounded weight management drugs. The bill's provisions do not apply to physicians or and surgeons. The recent amendments update the proposed disclosure requirements regarding potential side effects, adverse reactions, and other warnings associated with active ingredients in the medication, unless the advertiser can demonstrate that a particular disclosure is not relevant to the compounded drug. I note that the measure does not apply uniformly across all settings where GLP-1 compounding occurs, such as physician offices and medical spas. The board staff have encountered significant patient safety issues in these environments during inspections and investigations, but often lacked the authority to intervene, and staff believe patient safety gaps will persist unless the requirement applies to all compounding and advertising settings. Staff have expressed concern about the bill's mandatory penalties, $1,000 per dose and license revocation, which removes the board's discretion to evaluate cases and determine appropriate enforcement consistent with its consumer protection mandate. I also note that some requirements in the bill already exist under federal law, USP standards, or existing board regulations, while others go beyond the current standards. Following release of the meeting materials, the measure passed out of the Assembly Privacy and Consumer Protection Committee and was referred to the Assembly Appropriations Committee. I agree with the recommendation to establish a watch position and believe it is appropriate for board staff to engage with the Offers Office to seek to address the concerns and issues raised. Members, I welcome your thoughts and also welcome establishing a position if you believe such action is appropriate.
Question, please, Madam Chair. What is the potential fiscal impact to the board in terms of this legislation if it were to be codified?
I will defer to Ann on that one.
So at the staff level, we're probably going to have, like our inspections will most likely take longer when we're doing inspections and investigations that are, because we already regulate the sites, right? It'll just probably be extensions of some of those inspections and investigations. What we're unclear on, honestly, is like what that offset would be, because the measure does include like automatic, like $1,000 fine per vials, those kinds of things. It's hard to kind of understand what that cost analysis would be. So I apologize that I don't have good figures for you. We do believe from an impact perspective, like our investigations into this will likely take longer and expand beyond, because we're measuring against additional things beyond the board's compounding regs and state and federal law that currently exists. So they may become more complex, but there would be the offset of the fines that are, established in that, automatically established. So the board's discretion in that area is gone. The other potential cost thing is, I don't know, but the law seems to envision that the licenses are revoked. And so unclear on what that due process would look like. And depending on what that due process look like, I'm going to assume that there's potential liability, like lawsuits and those kinds of things. I don't know. I'm not an attorney. Forgot to give my disclaimers at the front end.
Thank you, Ann.
This is Maria, and you know that compounding used to be my life, but still is. I have serious concerns about this bill. The concept, I think, is good, and we certainly want to make sure that compounding is only done for good reason, good products, and for the benefit of the patient. I am concerned when it's only talking about one product, and there are like political and other reasons why that is. But the content of the bill, I think has been stated by both Jesse and Ann, is very concerning in that it steps on current board regulation and federal regulations. I was going to say standards, but you know what I mean. Federal laws, national standards, and board regulations. It messes the landscape up because of not being consistent. That's one area that is very, very complicated. The other thing that I'm very concerned about is the bypassing of the board's authority and bypassing the pharmacist's judgment. There are times when compounding is appropriate, and the board recognizes that there are times, and then that works. There are some guidelines given to pharmacists to provide that authority as to when they compound and how they compound within the broader scope of law and regulation. This removes the board's authority in many areas, and also eliminates the pharmacist judgment in determining what's best for their patient. So I think that I agree with the watch right now until June, until we have more information, because I think this is a very hot button issue. It's very highly charged, and I think it's too early for us to take a position. So I agree with the staff's watch.
Great. Thank you, Maria.
I'll jump in as well. I wanted to hear what Maria had to say, but I agree. I think we spent so much time on our state regs around compounding that it sort of undermines ourselves if we support a bill that changes those. Like, we spent so long to make those really good and really safe. I don't think we necessarily need to go beyond them. And I agree with Maria doing it for a singular drug class. There are times it makes sense to call it a drug class, but in this case, it feels like it's just in the interest of the manufacturers and their profits and not necessarily for patients. I am concerned to the points that Anne was making earlier about med spas and other places that we maybe don't have jurisdiction over and would love to see that corrected. But I don't love the idea of us being a tool for the drug manufacturers to preserve their profits. And there are a lot of situations where a compounded product makes sense. A lot of people are taking smaller doses of these drugs that don't exist. Some people, you know, are allergic to the excipients, all kinds of reasons. So I can agree with the watch, but I'm almost leaning more towards an oppose. And I get the idea of waiting till June, but sometimes if you wait too long, then our opposition won't be seen by as many people and won't be as strong.
Great. Thank you, Nicole.
Madam Chair, real quick. It says here the bill, do we have any idea what the amendments were coming out of Assembly Privacy Committee?
I'm going to defer to Anne on that one.
So my understanding, assume all of my disclaimers, it's specifically about the advertising and the disclaimers that need to be. So as I understand it, the bill would require, if the product is compounded, the bill would require similar disclaimers as to what is required or disclosures that is required when you receive the manufactured product, unless the compounder has, I don't know, evidence to say that it's not relevant for their compounded product.
Okay. Second question, are we suggesting any specific amendments at this point in time?
I think I've heard a few so far, or at least concerns. I think we'd probably have to refine that a little bit, but I've heard it should apply equally. If we go forward, it should apply equally to all areas where this is compounded, not just pharmacies. I've heard concerns about the lack of discretion that the board would have in terms of enforcement outcomes based on investigations. So I've heard that. I think Maria talked a little bit about it, but maybe not in as much. So I don't want to speak for you, but there are areas where, you know, the information is already covered in federal law, USP standards, or regulation. And so when it's stated again, it can create some confusion. So maybe addressing some of that, but it would really depend on whether or not you're getting the more global change to it applying equally across all, because across all would then probably change some of the amendments that the board would ask. So I think you'd probably have to start at the big and then kind of see where that went, and then that might drive future changes, if that's making sense at all.
I'd be really concerned about offering amendments, because that kind of implies that we support the overall global concept. And I really don't support bypassing the board's authority or the pharmacist's clinical judgment. I think those things in the proposed legislation are very concerning. And I would not, I mean, I did state that having one class of drugs is concerning, but that's not the primary issue. That was just showing how narrow and focused and laser focused this bill is on one issue for one group of stakeholders, I guess you could say. So I would not be doing anything to amend. I am interested in hearing a little bit more, maybe from members of the public if afterwards, or maybe from the full board, about having a true oppose. I'm not sure if the board's ever done oppose unless amended. That's not typically done by the board. I've seen that done in other organizations. But I'm curious about that since Nicole brought it up. You know, typically the board does not stand firm on opposing things that tread in our arena, because we agree with having a collaborative approach. So I don't think the only reason we should oppose it is based on that they're stepping in our pond, so to speak.
I have a question. Have we had a conversation with Assemblymember Gibson at all?
So staff have answered some technical questions, but we have not engaged in offering any kinds of changes until after we have the benefit of the conversation.
Or even just for clarification?
Just general kinds of technical kinds of questions.
Okay, thank you.
So I don't know if Nicole made a motion, but I would suggest that we have a broader conversation, including more members of the board before we have a firm position. And maybe as a committee, we don't come up with a position and have this discussion with the full board, because this is actually, I think, a bigger topic.
I think that's a good idea, Maria. I agree.
And there was no formal motion.
And also, in the full board, we do have our board member who is a compounding expert. So I'd be curious as to her comments too.
Agreed. Perfect. So if there are no other comments from members,
Give her a heads up that we're going to talk about.
we're ready for a public comment in Sacramento. And seeing none, we're ready for public comment via WebEx.
Hi, this is the moderator. If you would like to have a comment, please click on the raise hand icon at the bottom of your WebEx screen. And if you are a call-in public member, press *3 to raise your hand. We do have a couple of comments. Andre, you are first. I'm going to be sending you the unmute request. Please click on that to make your comment. Thank you.
Hi, can you hear me okay?
Yes, please go ahead.
Yeah, thank you. Andre Peters, I'm giving this comment in my private capacity. I fully agree with board members here, Serpa and Tabu, for expressing concerns with this bill. I agree with every single one of the points both you were making. I'd like to maybe add a few things here. We already have a very robust set of standards of the USB that gets enforced by regulation. That if those are followed and enforced, it would ensure the quality of product that this bill seeks. I'm really worried on the practical side of things. The bill says that whoever compounds these medications must conduct quality testing on the API to do proper quality testing according to the applicable standards. You basically need a full lab to do that. So that and to send that out under contract would add enormous cost. Ultimately to the pharmacy, which would then pass down to the patient. This bill says, for example, to get drugs from FDA sources, the standards and regulations already require that. I'm really worried that pharmacies would basically be held to these standards, and yet physicians can just make it in their office now. Without any of these standards, any sterility standards for injectables. This is going to be really, really bad for patients. I think if this bill passes, there would virtually be no pharmacy in California compounding these drugs, because if what this bill requires, if you have a missing initial, a missing piece of paperwork or anything minor, that this bill requires that the board shut down the pharmacy. I think we all agree that we want high standards, but this is really draconian, and it's going to ultimately, if there's no pharmacy making this, then there's no patients that's going to be able to get this drug. These drugs are made for a very wide population base, applying to a multitude of patients. And the individualization is needed in some cases because the manufactured doses doesn't work for all patients. So I think just on the basis of that this would reduce patient access, doesn't really tend to make things safer for patients. We should consider opposing this bill. Thank you.
Thank you so much for your comments.
Next up, we have Gabrielle. Gabrielle, you're going to be seeing an unmute request. Please click on that to make your comment.
Hello, my
Yes,
name
we-
is Gabrielle Casal. Great, thank you. I'm formerly with FDA's Office of Compounding Quality and Compliance, where I spent 9 years, and prior to that with the Pew Charitable Trust, and I'm now an independent consultant on compounding policy. I recently submitted a letter to the board on behalf of Novo Nordisk describing evidence for patient harm associated with compounded GLP-1 drugs and encouraging support for this legislation that we're discussing through increased API quality standards and testing. I think it's important to recognize that mass compounding of weight loss drugs really is a new phenomenon. The scale of this, frankly, as someone who's been in this space for a while, goes well beyond the bounds and intent of current compounding law. It's straining regulation. State regulators across the country are struggling with how to address this scale of compounding in the GLP-1 space. This production is fueled by imported API. There's enough, for example, semaglutide API in the country right now to make 2 billion starting doses of compounded drug API imported for use in compounding. We really have a huge increase in public exposure here that's beyond what normally where we see compounding. When there's a legitimate medical need, right, you really can't take the approved drug and you need something specific. The scale it's different than that. And when you have that public exposure, I think it's extremely right to look at safeguards and do a little more to protect the public. And we have a growing body of evidence that is identifying concerning impurities in some of these drugs, including what are known as peptide-related impurities. And these aren't tested for under current standards, by the API supplier or the compounder. These drugs can be immunogenic, absent special controls or enough controls, and these peptide-related impurities can cause serious immune responses, and they can also result in the formation of anti-drug antibodies that can make a GLP-1 ineffective for patients over the long term, or could even neutralize a patient's own native GLP-1. So this bill would look to specifically tighten up on impurities testing requirements. Also, just to point to the earlier commenter, the bill also would require that the supplier shipping the API for use in compounded drugs in California be providing this API testing information and the other sourcing information described in the bill. So the compounders themselves would not necessarily need to be testing the API in that case. We have adverse event reports about these compounded drugs, 1,500 for GLP-1s, 372 hospitalizations. It's been increasing year over year, and a FAERS analysis found that looking at approved drugs versus the compounded drugs, there may be an association of a higher probability of adverse events with the compounded versions. So I really encourage the board to continue to discuss this. If there's specific changes, such as on the enforcement provisions or the like, that the board feels would be helpful, encourage you to
10
speak with
seconds.
the office as well, and just recognize that we're dealing with really a new phenomenon here that warrants special attention. Thank you.
Thank you so much for your comments.
Next up, we have Sean. Sean Kim, you're going to be seeing a unmute request. Please click on that to make your comment.
Good morning, board. This is Sean Kim from California Pharmacists Association. CPHA shares the author's commitment to patient safety and addressing the unsafe compounding practices. However, as currently drafted, this bill goes beyond the existing regulatory framework and risks unintended consequences to compliant pharmacies. These provisions could force many compliant compounding pharmacies out of the market, ultimately reducing the access to the essential medications, particularly for patients with unique clinical needs. If the goal is to protect the patients, a more effective approach would be targeted enforcement against bad actors rather than broad requirements on already regulated pharmacies. Thank you so much for letting me comment.
Thank you for your comments.
Next up, we have Henry. Henry, you're going to be receiving an unmute request. Please click on that to make your comment.
Hi, Henry Chan here, Common Spirit Health. I do agree with all the concerns about this bill. The additional testing that is proposed for patient-specific preparation makes it very difficult even for a legitimate pharmacy to prepare for legitimate use. And if this bill passes, it kind of sets up a precedent and it opens the door for other drug manufacturers to kind of do additional protection for their own drug, for their own, you know, yeah, I mean, I think there's a lot of things on here that kind of prohibits even pharmacy to prepare this, you know, in a legitimate way, and it just opens the door for other manufacturers to kind of do further protection for their own gains. So yeah, thank you.
Thank you for your comments.
Next up, we have Sam Martinez. You're going to be receiving an unmute request. Please click on that to make your comment. Thank you.
Good morning, Sam Martinez, registered pharmacist. I just want to start by saying that I fully support efforts to stop any inappropriate compounding practices, especially operations that compound medications without appropriate pharmacy license, oversight, or qualified personnel. My concern, however, is that AB 1990, the way it's currently structured, appears to create overlapping and potentially confusing regulatory framework without clearly addressing the core problem. The first issue is scope. The proposal seems to exclude physicians and surgeons, yet physicians are one of the primary groups involved in office-based preparation, handling, and administration of medications outside pharmacy standards. If the goal is to improve safety around medication preparation and compounding, it's difficult to understand why a major practice setting would be excluded. If the concern is office use compounding, then the bill should clearly and directly address that issue. The California State Board of Pharmacy, as already mentioned, is an extensive regulatory structure for governing compounding, which took a long time to get approved and is based on USP 797-800. Overlapping regulations can create unintended consequences, as mentioned, may produce duplicated oversight, inconsistent interpretations, administrative burden, and uncertainty for current pharmacy legally compounders. I just think these burdens need additional oversight and review more formally. Thank you.
Thank you for your comments.
Next up, we have Taniel Davis. You're going to be seeing an unmute request. Please click on that to make your comment. Thank you. Daniel, if you are speaking, you are still unmuted. If you're still muted, please click on the unmute request on your screen to.
Can you hear me now?
Yes, we can. Please go ahead.
Thank you. Good morning. My name is Tamiel Davis, and I'm here on behalf of the Alliance for Pharmacy Compounding. I'm asking the board to take an opposed position on AB 1990. This bill is presented as addressing advertising and consumer protection, but the conduct it targets is already prohibited under existing law. Pharmacies today cannot engage in false or misleading advertising, cannot represent compounded medications as FDA approved, and are already subject to oversight by this board and federal regulators. California has also just implemented new compounding regulations that went into effect in October. Those rules significantly expanded requirements around testing, sterility, and pharmacy practice. Pharmacies are actively working to comply with those standards right now. AB 1990 adds another layer on top of that framework without identifying a clear gap in current law. There's also real implementation concerns. The bill creates ambiguity around what must be disclosed and how information about compounded medications can be presented. In practice, it risks pushing pharmacies towards labeling expectations that resemble FDA-approved drug requirements while still restricting how they can provide context to patients and prescribers. That creates confusion and makes compliance more difficult. I also want to briefly address the safety narrative around GLP-1 therapies. Public discussions often suggest compounded versions present unique risk, but it's important to keep perspective. FDA-approved GLP-1 products have a vastly larger volume of reported adverse events, largely because they are used at a scale across millions of patients. Raw adverse event numbers without context don't tell a complete or meaningful safety story. From the board's perspective, this bill could also create enforcement challenges. Vague or overlapping standards make it harder to apply rules consistently and may divert attention from clear violations that already exist under current law. For these reasons, we respectfully ask the board to take an opposed position on AB 1990. Thank you for your time and consideration.
Thank you for your comments.
We don't have any other comments. Please, I return the floor back to you, Chair.
Great. Thank you so much, moderator. I do have a few thoughts. I'll just kind of start first. I appreciate all the public comment. I think it was, this is a good discussion. I'll start off by saying, you know, number one, kind of reiterating, we really can't isolate a specific drug class. The way that we're speaking about this and the way that the bill is presented is for weight loss, but I do want to emphasize the other health benefits for GLP-1s, which is specifically for diabetes. We see benefits in heart failure. We see benefits in CKD. And so it's not just for weight loss, number one. I will say also, just being a person who sees advertisement, I do see a lot of advertisement specifically for compounded GLP-1s. And you see it on social media too, right? There's influencer who are advertising peptides and they're semaglutide, all of these other things. Now, I think that's an issue, but I have trouble just isolating a specific drug class. And as one of the commenters noted, once you set this precedence where you're isolating a drug class, it becomes a bigger issue. And we spent extensive time creating parameters around compounding as a whole. I think that's really it for my thoughts, but opening it up, I think Jeanette may have some thoughts
Well, I
too.
just have one question. Do we know who the organizational sponsors are of this bill, if any?
I don't think I saw any sponsors on the bill. Did you see any, Anne? Just some organizations in support. Anne's double checking right now.
As you're checking, I think one thing I would like to add, because we did have the person who spoke I think she said she was a consultant for Novo Nordisk. And, you know, many of the things that she said are very concerning, but I don't think you can take a global approach to states that don't have compounding regulations or don't have stringent compounding regulations and apply them equally across all regulatory environments. I think we're very proud in California that we not only enforce federal laws and national standards, but we have stronger California regulations for patient safety.
Great. Thank you, Maria.
Just filling in time.
Any other thoughts while Anne is taking a look? Oh,
Yeah.
Anne's ready.
No, I just wanted to say we'll likely need to reach out to the author's office
Okay.
to get confirmation.
Great. Thank you, Anne. Perfect. Okay. Moving on, Assembly Bill 2000, drug formularies. Members, as amended, AB 2000 bans health plans, insurers, and PBMs from changing their drug formularies during the plan year, except in limited circumstances. If a change would force a patient to switch medications, the patient may continue their originally approved and safe drug for the remainder of the year. The measure also requires 90-day advance notice before any changes, mandates reporting changes to the state within 30 days, and authorizes state agencies to audit, investigate, and penalize entities that fail to comply. This measure is awaiting action by the Assembly Appropriations Committee. I note that as currently drafted, the measure allows modification of a drug formulary to remove a drug due to safety concerns raised by the United States Food and Drug Administration, FDA. However, there are other reliable sources outside of the FDA. For this reason, I agree with the recommendation to establish a supportive amended position and recommend offering an amendment to include other reliable sources. Members, I welcome your thoughts on the measure and would also entertain a motion to recommend establishing a position if you believe such action is appropriate.
Hi, Jesse. I'll move to take a support if amended position.
Thank you, Nicole. And I will second that motion. We're ready for public comment in Sacramento. Seeing none, moderator, we're ready for public comment via WebEx.
Hi, this is the moderator. If you would like to make a comment, please click on the raise hand icon at the bottom of your WebEx screens. And if you are joining us by dialing in, you may press *3 to raise your hand. We are displaying instructions and we'll give you a moment. See no comments, I return the floor back to you, Chair.
Thank you, moderator. We're ready for the roll call vote. Jeanette, how do you vote?
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes, the motion passes. Assembly Bill 2141, Pharmacies License Discipline, Stipulated Settlement and Disciplinary Order. Members, as amended, AB 2141 offers the board and a licensee to enter into a stipulated settlement and disciplinary order before a formal accusation is filed, provided certain conditions are met, including the licensee voluntarily waiving administrative hearing rights under the Administrative Procedure Act and submitting specified mitigation and rehabilitation information. A designated board committee must review this information and is permitted to extend a stipulated settlement and disciplinary order offer to the licensee. This measure is awaiting consideration by the Assembly Appropriations Committee. Members, I note that between 2019 and 2021, the board explored creating an alternative enforcement model to improve the efficiency of its disciplinary process. During this time, the board explored several options but never finalized development of a proposal because at the request of stakeholders, the board stopped its consideration for the matter in July 2021. For this reason, I agree with the recommendation to not establish a position on this measure. Members, I welcome your thoughts.
Hi, this is Maria. This is another one that I have very strong thoughts on. I'm very disappointed that this has gone through a legislative route, this topic. The board has spent significant time in discussing with stakeholders and with the Attorney General's office about this different type of process or alternative enforcement process. We had lots of presentations, including presentations from other healthcare providers in California and what disciplinary processes they use. We had not only spent a lot of time, but we had started coming to a conclusion and were ready to move forward when stakeholders surprised the board and asked us to stop those discussions. One of the main concerns that we had as a board that still needed to be worked out was some of the legal implications of early discussions with board members. And if both parties could not come to an agreement, what were the implications to the pharmacy or the pharmacist on the disclosures that they made originally? And they had talked about things that they may or may not want to put on the record later. So, they're concerned for them. But there's also a big concern for the board in that if presentations were made or if board members were included in these committees to do these meetings, that the board members would then later, should there not be an agreement, would have to recuse themselves from discussions because they have information that was before the disciplinary process started. Those two things were coming to a conclusion, but the vast majority of concepts were already dealt with. And I know the staff spent significant time with the Attorney General's office to make sure that things were done in an appropriate fashion to protect pharmacies and pharmacists and to protect the public.
Great, thank you, Maria. Any other thoughts? Okay, seeing none, we're ready for public comment in Sacramento. And seeing none, we're ready for public comment via WebEx.
Hi, this is the moderator. If you would like to make a comment, please click on the raise hand icon at the bottom of your WebEx screen. And if you are a public member joining us via dial-in, you may press *3 to raise your hand. We do have a comment. Denali, you're going to be seeing an unmute request. Please click on that to make your comment. Thank you.
Can you hear me?
Yes, please go ahead.
Yes, thank you. This is Tennille Davis with the Alliance for Pharmacy Compounding again, and I am just here asking for the board to support AB 2141. It's a practical, process-focused bill that improves how enforcement actions are handled without changing the underlying standards pharmacies must meet. Pharmacies in California operate under a complex and highly regulated framework, particularly following the board's recent compounding regulations that went into effect in October. Those rules significantly expanded requirements around sterility testing and quality systems. As a result, compliance is not only critical, it is also increasingly technical. What AB 2141 recognizes is that not every issue identified during an inspection reflects intentional misconduct or an immediate threat to patient safety. In many cases, issues are procedural, documentation related, or require clarification under new or evolving standards. This bill creates an appropriate interim step before escalation, allowing pharmacies the opportunity to correct deficiencies and come into compliance before facing more severe consequences. That approach is consistent with how other states handle similar situations and reflects a more balanced enforcement model. Importantly, 2141 does not weaken enforcement. The board retains full authority to act in cases involving serious violations or risks to patient safety. What it does is create a clearer pathway for addressing lower risk issues in a way that supports compliance rather than immediately defaulting to punitive action. From a practical standpoint, this allows the board to better focus its resources on bad actors rather than expending time and effort on matters that can be resolved through timely correction. Ultimately, this bill supports a regulatory environment that is both protective of patients and workable for licensees who are making good faith efforts to comply with increasingly complex requirements. For these reasons, we respectfully ask you to support AB 2141. Thank you for your time.
Thank you for your comments.
I see no other comments. I return the floor back to you, Chair.
Okay, thank you, Butter. Thank you. Go ahead, Maria.
Just one point of clarification. I think that many people weren't around when we had the discussions in 2019 through 21, that the scope, and I think when you're going to see at a future enforcement meeting, the scope of the enforcement activities is most issues are dealt with in the inspection. They're corrected right on time. There's orders of correction. There are citations. There are so many issues that are dealt with before they even ever get to a disciplinary issue. Those are for the most egregious and for the most troublesome. So I think that that's one of the things I just wanted to make sure is that not every forgetting to sign a form or forgetting to write something down goes directly to disciplinary process. And that would I don't want that to be implied. Most issues are dealt with and corrected right at the time. We are fully focused on educating licensees and helping them to do the right thing because our licensees want to do the right thing.
Great, thank you, Maria.
Madam Chair, thank you, Maria, for all the background. I appreciate that as a newer public member. I do want to ask and clarify about a point made by the public speaker. Are any of the board, is there similar situations that this legislation attempts to address that already occurs in the other licensing boards within consumer affairs?
I think that's a question for Anne, so I'll default to her.
I'm probably going to have to, sorry, it's been a few years since we looked into this, so I apologize. I know that when we look at these kinds of issues across the board, one of the challenges is that you're not necessarily always looking at apples to apples comparisons. So as an example, right, we have a range of tools that we can use, including letters of admonishment, orders of correction, citations and fines for like all violations of pharmacy law. And I'm not quite sure that other state boards of pharmacy maybe have those same kinds of tools in their toolbox, as well as other healing arts boards. So I would have to probably do a survey because I think the last time we looked was, like 5 years ago. And I don't know that it was truly an apples to apples comparison because we do have different, tools that we can use to try to secure compliance.
Thank you. And I find it interesting. It just focuses on this board versus the numerous other boards that exist within consumer affairs. Just a comment. Thank you.
Thank you. I believe we do have to take a break, right? So we'll probably just use this chance to take a break now. We'll take a 15-minute break. I'm gonna have to do the math in my head. That brings us to 10:52. Is that right? Oh, yeah, we can just come back at 11 if that's easier for people, just to give you a little bit more time. We'll come back at 11.
So generous.
Thank you. We will need to take a roll call. Jeanette Dong.
Present.
Thank you. Maria Serpa.
Present.
Thank you. Nicole Tebow.
Present.
Thank you. And I'm here. We have a quorum. So moving along, Assembly Bill 2282, Health Facilities Emergency Medical Services. Members, as amended, AB 2282 allows a general acute care hospital to get a special permit to operate an emergency stabilization unit in Patterson, Stanislaus County. I have no idea if I pronounced that right. It's a separate location not connected to the main hospital to serve the community previously served by Del Pardo Healthcare District. This measure is awaiting consideration by Assembly Appropriations Committee. I agree with the recommendation not to establish a position on this measure, as well as the recommendation to offer technical amendments to ensure the board will have the authority to issue a pharmacy license to an emergency stabilization unit if needed. Members, I welcome your thoughts.
Chair, I agree with the position because I'm not 100% sure you can have a standalone emergency department. And I don't know if stabilization is a euphemism for that, but I'm not even sure it can happen. So I agree with the position.
Great, thank you. If members don't have any additional comments, we can open up for public comment in Sacramento. Seeing none, moderator, we're ready for public comment via WebEx.
Hi, this is a moderator. If you would like to make a comment, please click on the raise hand icon at the bottom of your WebEx screen. And if you are a 10-second warning to make your comment, and we are displaying instructions. I see no comments. I return the floor back to you, Chair.
Great, thank you, moderator. Assembly Bill 2565, Medi-Cal Pharmacist Services Reporting. Members, following release of the materials, AB 2565 was amended. As amended, AB 2565 requires the Department of Healthcare Services to issue guidance clarifying Medi-Cal managed care plans' obligations to cover pharmacist services. It directs DHCS to update its model evidence of coverage to explicitly state that pharmacist services are covered. DHCS must also take corrective action if plans fail to comply with existing pharmacist service coverage requirements for the new guidance. The measure authorizes DHCS to implement these provisions through all plan letters, or similar instructions without needing to go through formal regulatory process. The measure is awaiting consideration by Assembly Appropriations Committee. With these amendments, members, I believe the board should establish a support position on the measure. I welcome your thoughts and invite a motion if you believe such action is appropriate. Okay, I will go ahead and make the motion to support this measure. Do we have a second by any members?
Jesse, I'll second.
Thank you, Nicole. We will open up for public comment in Sacramento. And seeing none, moderator, we're ready for public comment via WebEx.
Thank you. This is the moderator. If you would like to make a comment, please click on the raise hand icon at the bottom of your WebEx screen. And if you are a call-in public member, you may press *3 to raise your hand. We do see one comment. Sean, you're up for the comment. You're going to see an unmute request. Please click on that to make your comment. Thank you.
Good morning, board. This is Sean Kim from California Pharmacists Association. Thank you so much for considering to support the position. The bill, if I can provide you with a little bit of background, there has been much advancement in terms of pharmacist practice and scope of practice, especially with the AB 1114 that passed back in 2016, which addressed what you can do for Medi-Cal coverage, such as immunization, smoking cessation, HIV, PrEP, and PrEP. I don't need to preach to the choir, but there are like such authorities that you can find under 4052, and that is supposed to be covered through Medi-Cal. However, that is not necessarily mean that translated into the current day-to-day practices due to many different factors that, as you probably heard about, it is also delegated to managed care organizations, and there are currently 24 of them in the state. Depends on which county you belong. You may have 2 or 3, even 1, and the MCOs may delegate such services under managed care plans, such as independent physician associations like IPAs. So when a pharmacy try to provide these services on their day-to-day practices, they may find much fragmented way to get enrolled and provide the services. So there happen to be a lot of rejections, and there's no capture data or transparency of the current practice. And oftentimes it is very discouraged for pharmacists to continue to provide those services, including smoking cessation, while they have done it before, but because there's no financial stability or sustainability of those practices. That's why we have identified that these are some of the problems that has to be resolved in order for us to actually advance the practice of pharmacy in California. Not only we just change the BCP code, but also WIC code that accounts for those data measure is very necessary. Therefore, I would love to encourage the board to consider support the position. Thank you so much for letting me comment. I can provide further details tomorrow's full board meeting as well. Thank you.
Thank you so much for the comments.
I see no other comments. I turn the floor back to you, Chair.
Thank you. We'll do a roll call vote. Jeanette, how do you vote?
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes, the motion passes. Assembly Bill 2571, reimbursement for pharmacist services. Members, AB 2571 requires that advanced pharmacist practitioners be paid the same rate as physicians under Medi-Cal, 100% of the physician fee schedule instead of the current 85%. I note that this measure is similar to AB 1366, on which through the delegated authority given to the board president, the board had established a support position. The measure passed through Assembly and is currently pending the Senate rules for assignment. I agree with the recommended support position for this measure. Members, I welcome your thoughts and also would entertain a motion if you believe such action is appropriate.
Hi, Jesse. I'll move to take a support position.
Thank you, Nicole. I will second your motion. And seeing no other member comments, we're ready for public comment in Sacramento. Seeing none, moderator, we're ready for public comment via WebEx.
Hey, this is the moderator. If you would like to make a comment, please click on the raise hand icon at the bottom of your WebEx screen. And if you are a call-in public member, press *3 to raise your hand. You'll have 3 minutes with a 10-second warning to make your comment. We are displaying instructions and we'll give you a moment. See no comments. I turn the floor back to you, Chair.
Thank you. I'll bring it back for a roll call vote. Jeanette, how do you vote? Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes, the motion passes. Senate Bill 915, healthcare provider entities, patients accompanied by immigration enforcement officers. Members, as amended, Senate Bill 915 requires healthcare providers entities to verify and document the identity and agency of any immigration enforcement officer who accompanies a patient. Staff must ask the officer to step out during medical discussions or treatment with limited exceptions, and the officer is prohibited from making or influencing medical decisions. If an officer refuses to comply, staff must report such refusal to management or legal counsel, who must document the incident and, if possible, record the officer's name and badge number. The measure also establishes requirements for care transitions and discharge planning consistent with state and federal law. I note that this measure passed out of Senate Judiciary Committee with amendments on April 21st. I believe the amendments just became available. Unfortunately, we have not had a chance to review them.
It just clarified, Jesse, that if you offer that and then the immigration officer doesn't leave, you already have fulfilled your duty. You've said, please leave, and they said, no, you can document it, but there's no other thing that you need to do except for document it.
Great, thank you for that. The current position from the board was to not make a position. We were waiting initially for the print. generally in support of the concept, but I'm interested to hear how our discussion goes and where we go in terms of a position. I definitely think that we need to have patient autonomy and privacy. And I agree with the concept. So I'm going to open it up for discussion from other members and see where we land.
I would move, and I would support a support position.
Did you want to make that motion?
I move to support.
Okay, thank you. Do we have a second?
This is Nicole. I'll second.
Perfect. Thank you, Nicole. Hearing no other comments from members, we will open up for public comment in Sacramento. Seeing none, moderator, we're ready for public comment via WebEx.
Hi, this is a moderator. If you would like to make a comment, you may look for the raise hand icon at the bottom of your WebEx screen. And if you're a call-in public member, you may press *3 to raise your hand. We are displaying instructions and we'll give you a moment. See no raised hands. I return the floor back to you, Chair.
Thank you, moderator. We're ready for a roll call vote. Jeanette?
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes, the motion passes. Senate Bill 964, Prescription Drug Coverage Dose Adjustments. Member, as amended, SB 964 enables a patient's treating provider to adjust patient medication doses or dose frequency without seeking prior authorization from health plans or insurers under specified conditions. This measure is currently on Senate Appropriations Committee suspense file. I agree with the recommended support position for this measure. Members, I welcome your thoughts and would entertain a motion establishing a position if you believe such action is appropriate.
I move to support.
Thank you, Nicole. Do we have a second?
Second.
Thank you, Maria. We'll open it up for public comment in Sacramento. Seeing none, moderator, we're ready for public comment via WebEx.
Thank you. This is the moderator. If you would like to make a comment, please click on the raise hand icon at the bottom of your WebEx screen. And if you're a public member joined us by call-in, you can press *3 to raise your hand. We are displaying instructions and we'll give you a moment. See no comments. I return the floor back to you, Chair.
Thank you. We're ready for a roll call vote. Jeanette, how do you vote?
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole. Sorry, thank you, Nicole.
Yes.
Thank you, and I vote yes, the motion passes. Senate Bill 1023, Healthcare Coverage, Antiretroviral Drugs, Drug Devices, and Drug Products. Members, with respect to SB 1023, current law prohibits healthcare service plans, except Medi-Cal managed care plans, and health insurers from requiring prior authorization or step therapy for medically necessary PrEP or PEP, but allows them to apply these restrictions to other therapeutically equivalent versions as long as one option is available without restriction. Senate Bill 1023 removes that exception and fully prohibits prior authorization or step therapy for all antiretroviral drugs, devices, or products used for HIV prevention. Beginning January 1st, 2027, any plan that covers FDA-approved non-self-administered HIV prevention treatments as a medical benefit must also cover them as an outpatient drug benefit, prescription drug benefit. This measure is similar to AB 554, which the governor vetoed, but differs in scope. AB 554 broadly addressed coverage and access requirements for all antiretroviral drugs used for HIV treatment and prevention, while this one focuses narrowly on resolving a specific reimbursement issue for injectable long-acting PrEP by creating a workable, billable pathway for clinics. The board had a support position on AB 554. This measure is also on the Senate Appropriations Committee suspense file. I agree with the recommended support position for this measure, and I welcome your thoughts, members, and would also entertain a motion if you believe such action is appropriate. I'll move to support this measure. Great, thank you. With a motion and a second, we'll open it up for public comment in Sacramento. And seeing none, moderator, we're ready for public comment via WebEx.
Thank you. This is the moderator. If you would like to make a comment, please click on the raise hand icon at the bottom of your WebEx screen. And if you're a call-in public member, you may press *3 to raise your hand. We are displaying instructions and we'll give you a moment. See no comments. I return the floor back to you, Chair.
Thank you, moderator. We're ready for a roll call vote. Jeanette?
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Abstain.
Thank you. I vote yes, the motion passes. Senate Bill 1094, prescription drugs. Members, as amended, SB 1094 would allow a pharmacist to substitute a biosimilar drug, which is a nearly identical version of a brand name biologic drug, when filling a prescription, as long as the prescription does not include "do not substitute" or words of similar meaning as specified. Following release of the committee meeting materials, this measure passed out of the Senate Health Committee and will be considered by the Senate Appropriations Committee on May 4th. I note that current law grants a pharmacist the authority to select an interchangeable biological product, and this measure expands these provisions to allow a pharmacist to select a biosimilar product. I agree with the recommended watch position for this measure. Members, I welcome your thoughts and would also entertain a motion if you believe such action is appropriate.
Trustee, this is Maria. I'm not sure why we don't support this measure and why we're on a watch or suggesting a watch.
Thank you, Maria. I will say from just my perspective, I have dealt with some biosimilars and just biologics in general. And my concern is that a lot of doctors prefer specific products versus a biologic. And so my concern personally is not going through that formal process of actually getting the authorization from the doctor and creating friction with the prescriber. But I'm open to see how this discussion goes.
Yeah, unless I hear more information, I'm very familiar with switching between the biosimilar products. And to me, I think that if the physician really wants a specific brand, even for other medications, you know, we talked about generic substitution in other drugs that they would have to write "do not substitute," and they can do that. You know, back in the day, they used to do that for Vicodin, "do not substitute." But there's also other injectable products where they may prefer a certain brand, and so. But the biosimilars, I see no difference than any other generic in this situation. So, willing to learn more, but. And unless there's more information, I would think we would support, it would be the same rationale as generic drugs.
Thank you, Maria. Yeah, it's an interesting discussion too. Just one final thought too is in support of your support position, this could also facilitate more timely access to medications in a lot of ways, because a lot of time we, at least from like the outpatient setting, we have barriers to dispensing medications due to prior authorizations or other utilization management reviews where they prefer one biologic over another. So if you'd like to formally make a motion.
Well, I think as I stated, you know, I have an opinion, but that's also based on my limited experience. And so perhaps, you know, not that I want to suggest that we go back to the board, but unless we have public comment saying that we should support this, perhaps this should be a better discussion with more pharmacists and the full board.
Okay.
So I'd be okay with the watch, especially since we have a meeting in June as another opportunity.
Great. Thank you, Maria. Any other comments from board members? Okay, hearing none, we're ready for public comment in Sacramento. And seeing none, moderator, we're ready for public comment via WebEx.
Hi, this is the moderator. If you would like to make a comment, please click on the WebEx raise hand icon at the bottom of your screen, and you can press *3 if you are a call-in public member. You'll have 3 minutes with a 10-second warning to make your comment. Andre, we see a raised hand. You're going to be seeing an unmute request on your screen. Please click on that to make your comment.
Thank you for the opportunity to comment. I'd like to give some clarity on this bill. I think in general, most pharmacists feel very supportive of the ability to add to add the wording of biosimilar to the Business Professions Code. So no issue there, even though it doesn't really change much in what we currently do, because biosimilars are also considered biological products. And so, at least from a health system perspective, there are already formularies in play and contracting with manufacturers to get the most optimal pricing for the drug, to save costs, not only to the pharmacy, but also to the patients ultimately. The problem comes in with the second part, which is the insurance part. And specifically, the wording is very much in favor of the insurance. And even though it is focused on the enrollees cost sharing, I think for those of us working in this space, what already happens is an infusion pharmacy would go and contract with a specific manufacturer to get volume discounts and optimal pricing. On the other side, the insurance companies do the same as well. So they would actually go and contract with a specific manufacturer. And when the patient shows up and there's a prior authorization, the pharmacy has to then go and buy off contract at a higher cost to the pharmacy and the patient a product from a manufacturer that does not give us the most optimal discount. So that ultimately increases the cost of purchasing. It also now requires the pharmacy to add many manufacturers' drugs on our shelf. And usually these drugs, for those working in the space, you're not talking about $10 or $20, not even hundreds of dollars, but these drugs go in the thousands of dollars. So adding an NDC on a $20,000, $30,000 drug really makes a big difference in the inventory costs that we carry. So unfortunately, I would not be in support of this bill because I don't feel like the cost savings would ultimately translate to the patient. The only winners in this case is unfortunately going to be the PBMs and the insurance companies. Thank you for allowing me to maybe just get some of the behind the scenes information.
Thank you. I really appreciate your comments.
Sean, you're going to be getting the unmute request. Please click on that to make your comment. Thank you.
Hi, Sean Kemp from California Pharmacists Association. We too share the concerns about potentially vertical integration and patient steering parts that could be the concern for this bill. So we would support the bill if amended, making sure that there's a pharmacist's ability to capture that if there's the parts that pharmacists can take, making sure the patient's needs. And in general, this is a good bill with the intention to apply interchange biosimilars, not just the interchangeable biosimilars, but biosimilar in general. But we have to be careful with vertical integration for this unintended consequences again. Thank you.
Thank you for your comments.
I see no other comments. I return the floor back to you, Chair.
Great, thank you. Okay, moving on to the next bill, Senate Bill 1199, Prescription Drug Cost Sharing. Members, SB 1199 requires plans and insurers to count all payments made by or on behalf of an enrollee, including permitted manufacturer assistance, towards their out-of-pocket maximum and other cost-sharing requirements. It also establishes an administrative penalty for each violation by a health insurer, enforceable by the insurance commissioner after notice and opportunity for a hearing. I note that this measures appears to be designed to benefit patients by ensuring any financial assistance they receive towards prescriptions, such as manufacturer copay coupons or third-party assistance, counts towards their in-network deductible and out-of-pocket maximum. Following release of the committee meeting materials, this measure passed out of Senate Health Committee and was referred to Senate Appropriations. I agree with the recommended support position for this measure. Members, I welcome your thoughts and would entertain a motion if you believe such action is appropriate.
Hi, Jesse. I'm just going to flag how I do support going to move to take a support position. Just wanted to flag how important this is for some very high cost disease states, something like HIV. I see a lot of patients who use the manufacturer patient assistance programs. And then because that takes a big chunk of their deductible, they either never clear their deductible or only clear it in like the final month of the year, and then it almost immediately resets. So I am very much in support of this and think this is important. If the deductible's paid, I don't think it matters who pays it. It's cleared and the patient should not be responsible for it after that.
Thank you, Nicole. I'll second your motion. That was a formal motion, right? I think, okay, perfect.
Yes, sorry, I mixed it in with my comments, but
No,
yes,
that's
that was
okay.
a formal motion.
Okay. And if we don't have any additional comments from members, we'll open it up for public comment in Sacramento. Seeing none, moderator, we're ready for public comment via WebEx.
Thank you. This is a moderator. If you would like to make a comment, please click on the raised hand icon at the bottom of your WebEx screen. And if you're a call-in public member, you may press *3 to raise your hand. We are displaying instructions and we'll give you a moment. See no comments. I return the floor back to you, Chair.
Thank you, moderator. We're ready for a roll call vote. Jeanette?
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes. The motion passes. Senate Bill 1347, Pupil Health Emergency Stock Albuterol Inhalers. Members, existing law allows schools to stock emergency albuterol inhalers and permits school nurses or trained volunteers to use them to assist individuals experiencing respiratory distress. As amended, SB 1347 expands the program to include childcare programs operated by or contracting with a school district, county office of education, or charter school. The measure remains on the Senate third reading file. I note that this measure's provisions appear only in the Education Code, which may limit pharmacies' awareness that they can legally dispense inhalers under these provisions. Board staff suggests making technical amendments to also reference this authority in pharmacy law, similar to existing cross-reference for emergency epinephrine and naloxone, Business and Professions Code 4119.2 and 4119.8. Adding a parallel provision in pharmacy law could help ensure pharmacies clearly understand their authority to furnish emergency albuterol inhalers to schools and childcare programs. I agree with the recommended support position, and staff recommended technical amendments for this measure. Members, I welcome your thoughts and would also entertain a motion of establishing a position if you believe it's appropriate.
I move to support.
Thank you. Do we have a second?
Second.
Thank you. And we're ready for public comment in Sacramento. Seeing none, moderator, we're ready for public comment via WebEx.
Thank you. This is the moderator. If you would like to make a comment on this agenda item, you may press for raise hand icon at the bottom of your WebEx screen. And if you are a call-in public member, you may press *3 to raise your hand. We are displaying instructions and we'll give you a moment. I see no raised hands. I return the floor back to you, Chair.
Thank you, moderator. We're ready for a roll call vote. Jeanette?
Yes.
Thank you, Maria.
Yes.
Thank you, Nicole.
Yes.
Thank you, and I vote yes. The motion passes. Regulations, all portions. Members, all items included in the regulations portions of the report are for information only. As detailed in the meeting materials and associated attachments, the board has several regulations in various stages of promulgation. I do not intend to review each as the information is contained in the public materials. The board has one regulation undergoing a 45-day comment period, 4 regulations undergoing pre-notice review. Staff are revising or preparing regulation documents for 2 regulations, 3 regulations have been withdrawn from the Office of Administrative Law, the OAL, and 1 package was approved by OAL. Members, do you have any questions or comments about the regulations? And we'll start with public comment in Sacramento. Seeing none, moderator, we're ready for public comment via WebEx.
Hi, this is the moderator. If you would like to make a comment, you may look for the raise hand icon at the bottom of your WebEx screen. And if you are a public member joining us via call-in, you may press *3 to raise your hand. We are displaying instructions and we'll give you a moment. Sean, we do have a comment. Sean, you're going to be seeing an unmute request. Please click on that to make your comment. Thank you.
Thanks for letting me comment again. Sean Kim from California Pharmacists Association. Just wanted to point out the document C regarding advanced pharmacist practitioner still states as a advanced practice pharmacist. Just wanted to point out the term change. That is all. Thank you so much.
Thank you for your comments.
I see no other comments. I return the floor back to you, Chair.
Great, thank you. Before we adjourn today, I would like to thank everyone for your time and participation. Our next meeting is scheduled for June 11th, 2026. Please watch the website for updates on this meeting. I look forward to seeing you later today for our full board meeting. Meeting is adjourned. Thank you.
Thank you.